Hi, my name is Austyn, and I am a registered nurse in Springfield, Missouri. The representative I'll be addressing is Jan Schakowsky about her bill that was introduced to the House on March 25th of 2015. The bill is H.R. 1602, Nurse Staffing Standards for Patient Safety and Quality Care Act of 2015. The Nurse Staffing Standards for Patient Safety and Quality Care Act of 2015 amends the Public Health Service Act to require hospitals to implement and submit to the Department of Health and Human Services a staffing plan that complies with specified minimum nurse-to-patient ratios by unit. This act requires the Department of Health and Human Services to develop a transparent method for establishing nurse staffing requirements above minimum ratios. It also directs them to adjust Medicare payments to hospitals to cover additional costs incurred in providing services to Medicare beneficiaries that are attributed to compliance with such ratios. So, if I were addressing Mrs. Schakowsky, I would tell her that I agree with this bill. As an RN myself, this is, I think, a real-world problem that we run into daily. There are a couple reasons why I do agree that this bill is a good idea. There's a few specific things that I'll point out. This bill would allow a nurse to object to or refuse to participate in any assignment if it would violate minimum ratios or if the nurse is not prepared by education or experience to fulfill the assignment without compromising the safety of a patient or jeopardizing the nurse's license. This bill also prohibits a hospital from taking specified actions against a nurse based on the nurse's refusal to accept an assignment for such a reason, and from discriminating against any individual for good faith complaints related to the care, services, or condition of the hospital or of any related facilities. So initially, this bill is saying that if you're a nurse and you're given a team that you think is unsafe because of the staffing ratio, you can refuse that assignment or a portion of the assignment, and if you think it's a safety issue, and then in turn that hospital can't actually turn around and fire you or punish you for any reason. This is essentially the nurse's way to protect her license and protect the safety and quality of care of her patients. Another great thing about this bill is that it adds stipends to the nurse workforce loan repayment and scholarship program. It also expands the nurse retention grant program to authorize programs to implement nurse preceptorship and mentorship projects. So nurses are increasingly put into impossible situations by hospital managers who demand they care for more patients than is safe. I myself, along with many of my coworkers, have firsthand experience of working with poor staffing ratios and the safety issues that come with it. There's a proven method to saving patients' lives, which this bill points out, and it can save patients' lives and it can save hospitals money, and that is mandated minimum nurse-to-patient staffing ratios. In Congress, Representative Jan Schakowsky is reintroducing her Safe Nurse Staffing for Patient Safety and Quality Care Act in order to improve patient quality of care by establishing a requirement for nurse-to-patient ratios that puts the safety of patients first. I would tell her that I, for one, would agree with this. Granted, I've only been a nurse for a little over 2 years, so what I do know of the workforce right now is that we are generally short-staffed. However, I do think that if our nation's hospitals could get the ball rolling on this, that it would in turn prove for safer outcomes, better outcomes for our patients, and also protection of the nursing licenses. According to the National Nurses United website, RNs nationwide are actively working to win their own mandated direct care RN to patient staffing ratios. RNs in other nations have also been fighting to improve conditions for their patients, so that just shows that this is a worldwide problem. Studies show that staffing ratios save lives, yet understaffing is a major safety issue, and RNs struggle with it every day. So I think that if this bill were put into play together with this bill, we could change that.